Thanks for watching On Call for All Kids. Today we'll be discussing the difference between seasonal allergies and COVID 19. We'll discuss the symptoms of seasonal allergies, what to do if you think your child has COVID 19, and how families can help alleviate allergy symptoms. I'm joined by Dr. Rachel Dawkins. She's the medical director of the Pediatric and Adolescent Medicine Clinics here at Johns Hopkins All Children's Hospital. Hey, Dr. Dawkins, how are you doing?
Hey, I'm good, Ashley. Thanks.
So, as you were saying, it was snowing pollen in your neighborhood just yesterday. It is that time of year. So, if we have those seasonal allergies, what do we need to know? Like, what's the difference between that and then COVID 19? Because here we are still in this global pandemic.
Yeah, so this is a great question. It's the time of year that many of us are suffering from allergies, including our kids. And we want to know, like, is this allergies? Is this COVID? Is this some other virus, perhaps? So thinking about what are the differences in the symptoms, because a lot of symptoms are the same, but thinking about allergies. So allergies usually cause a lot of itching. So itchy red eyes, and itchy nose are signs of allergies. So itching is allergies. Fever is not a sign of allergy. So if your child has fever, they could have COVID-19 or another virus or illness. Also specific to COVID-19 is loss of taste and smell. So if your child has one of those, likely not allergies, but a lot of the other symptoms can be similar. So like nasal congestion or cough. If there's other symptoms like vomiting, diarrhea, bellyache, those are not likely related to allergy. So just thinking about what the symptoms are, the itchy, watery eyes or the itchy nose, allergies.
So, if our child does have seasonal allergies, what can we do as parents to prevent them from being sent home from school or daycare since these symptoms are so similar? It's difficult.
Yeah, it really is difficult. So first I think about prevention. So, if you can avoid being outside right now, making sure your windows of your house aren't open. If you come in from being outside, have your child rinse off all the pollen they might have walked through. Um, some parents are not having their kids go outside for PE necessarily. Sometimes I think the mask that we're wearing could also help prevent some of the larger pollen particles from being inhaled. So masks can actually maybe be a good thing with allergies. And if your child has a history of seasonal allergies for which they're supposed to be taking medication, consider starting their medication if that's what the doctor prescribed. A lot of times parents will stop giving it when the allergy season's over, but this is the season. So talk to your pediatrician about if it's right to restart those medicines.
And what about what do we need to do if we think our child has COVID 19?
Yeah, so great question. So most kids, have either been asymptomatic or have mild illness. And so if you think your child has either been exposed or might have COVID-19, first of all, stay home and quarantine. Call your pediatrician to see if they feel like testing is needed, or call your health department to see where there might be a local site. At our clinic, we actually have a new area outside of the building where we can see sick kids in a really safe manner. So we're able to do some testing and not have them go to the emergency room or urgent care center to be tested. So we're really excited about that. So if you have questions or you're concerned, definitely call your pediatrician, but make sure, first of all, that your child's not going to school or going out and stay home in quarantine.
Finally, any last tips to help alleviate those allergy symptoms?
Yeah, wait for pollen season to be over is probably the best thing. But do what you need to do. Good hand washing and hand hygiene is also helps with allergies. And to take that away and make sure you're staying away from people staying masked so that we're not spreading COVID-19.
Well, Dr. Dawkins, it's always a tough time of year dealing with those allergies, but we appreciate you joining us today and telling us the difference between those allergies and COVID 19.
Thanks for having me.
And thank you all so much for watching. Don't forget, you can also check out our website. It's hopkinsallchildrens.org/newsroom. You'll find a lot of other timely topics in pediatric healthcare and other great resources for your family. We'll see you next week.